Welcome to the Resilience series. I'm Stephanie Weaver, the author of the Migraine Relief Plan and the upcoming Migraine Relief Plan cookbook. And for that project, I'm interviewing a variety of people about living well with a chronic condition like migraine. And my guest today is Dr. Jennifer Robblee. Dr. Robblee is a neurologist in the Jan and Tom Lewis Migraine Treatment Program and an assistant professor in the Department of Neurology at Barrow Neurological Institute in Phoenix, Arizona. Welcome, Dr. Robblee.
Thank you for having me. I'm really happy to be here.
Yeah, thank you so much. So tell us briefly about your background as a migraine doctor and whether or not you experience migraine.
For sure. So I've been out in practice now approximately 5 years, but I had a bit of a roundabout way to get into the migraine world. I initially practiced up in Canada as a general neurologist, and half my time was spent running a headache clinic. And I decided I wanted to go full head into the migraine world. So I actually quit what I was doing, came on down here to Phoenix, did a fellowship at Mayo for a year. And then I've started here at Barrow Neurological Institute. So I've now been here over a year. And it's exactly what I've wanted to do, because this is definitely a patient group I'm very passionate about. And I myself do have migraine. So ever since I've started working with patients who have migraine, I feel like it's a group that I've been able to relate to, have that true empathy for, and just really feel like it's a group that's been stigmatized and often not have enough care put towards it. And when I saw the differences you can make, it's sealed the deal for me. I knew that this is what I wanted to do.
That's great. Well, we appreciate it because there aren't enough headache specialists in the United States. So we need everyone we can possibly get. So thank you for coming down from Canada and joining the crazy healthcare system that you joined. Yep. Not fun, I'm sure. Okay, so you're a proponent. What we're going to talk about today is the SEEDS approach for patients. Yeah. So can you explain what the acronym SEEDS stands for?
For sure. So, I can't take credit with coming up with this. So it was originally described, I think, by Dr. Larry Newman. And when I was working at Mayo with Amal Starling, she was often using it. And I just thought it was such a great mnemonic, to the point that her and I actually published a paper. It was, I guess, 2018 or 19, where we basically went through and described what this SEEDS for Success is. So it's an acronym. The S stands for sleep. The first E stands for exercise. The second E stands for eat, which I really put with eating and drinking. The D stands for diary, so as in a headache diary. And then the last S stands for stress, so managing stress and using a lot of the behavioral techniques that we often use for management of migraine, as well as many other chronic conditions.
Great. So from me, since I have a book that's kind of a holistic approach and does integrate all the SEEDS, there's a tracking portion of it. There's certainly the diet is a big part of it. And by that, I mean the anti-inflammatory, getting on whole foods, that kind of thing. And then I refer to it as movement just because the word exercise kind of is kind of loaded for people, and not all of us can work out or exercise. Some of us can't do that, but we can all move. And so, but for sure, and then for sure the stress management. So how specifically do you counsel patients to integrate these SEEDS into their lives?
Yeah, so as part of every single new patient visit, I screen these. We have an intake form that actually has these on it. So right from the get-go, I have a sense of, is someone having good routine sleep and they feel restful? Are they snoring? Do I need to be worried about sleep apnea? Are they someone who, in spite of having migraine, they're exercising 3-4 times a week? Or is this someone who's very debilitated, barely getting out of bed, for them to do even a block walk would be a big deal. So get a sense of where in that spectrum someone sits. Are people skipping a whole bunch of meals? And if so, is that habit? Is it nausea? What types of foods are they eating? How much hydration are you actually getting? What's your caffeine intake? And then, generally get a sense of, are they actually doing diary? Are they tracking things? Do they have a sense of how often their headaches are happening, severe versus mild, when they're using their rescue medications? And then how much has, stress, depression, anxiety, any other psychiatric comorbidities played into all of this? How much disability is this causing? Is there a lot of absenteeism or presenteeism, which is when you're not necessarily missing your activity, but it's affecting your function at it? So trying to get a sense of all of that. So I have a starting place of, if someone's doing all of those things, then that may not be where the focus is. I just encourage them to continue it. But, if all of those things are just gone haywire, maybe choosing one that seems to be a big factor and then putting that together with some of the pharmacologic management and counseling that I'll do.
Great. And how often do you see people when they're a new patient?
You mean once they are a new patient, how often I see them? It really depends. So some patients I will see in about a month for follow-up, especially if there's a lot going on, if I'm making a lot of early changes. Other people, it'll be at about 3 months, especially if I'm starting a new preventive medication. That might take about 3 months before we really get a good time to assess. But I always give them a way to access me through Portal. So if at any point, if it is, say, 3 months out, if in 2 weeks they're having problems, then I want them to contact me, so I'll see them sooner.
Great.
And then very rarely, if someone's under super good control, I might put them out at 6 months or a year right from the get-go, but that's actually a small minority of my patients. So they're normally very good control. They're coming to me just to establish follow-up more in that case.
Sure, that makes sense. And how open are patients to following the seeds? What's your...
So I think it's really hit or miss. I have some patients that really go whole heart into it. Some patients who kind of feel like they're doing it and they really want something that, feels more like a fix, like a medication. And then some patients where they want to, but it's hard to really take it up. So I often will try to advocate really just baby steps if people are having a hard time jumping in. And I will involve people like physical therapy, a nutritionist to try to help educate and really look at a sort of multiple approach to how we can get it going. So it's variable, I think, is the answer, just as you'd expect with each person. Each person's
Sure.
individual. So I kind of treat them with where they're at.
Sure. So one of the things that's interesting to me is I suspect that not very many doctors are asking about these particular factors. And I know that part of why you all wrote the paper was to get it out into the literature so other people can understand how to implement this. But if someone's doctor isn't looking at any of these factors, what do you recommend a patient do? Just do it on their own, or?
I mean, a lot of these things are actually quite safe. So it is something that most patients can implicate on their own. But it's also something where they can bring it up with their doctor. I read that lifestyle factors can be helpful. If they want, they can even reference this paper because that one's at least out in the literature, and doctors like literature to base what they're doing on.
Yes, they do.
So something like that is helpful. And if you're not getting a great response and you're not getting the help that you need, check to see, it's worth looking to see, do you have a headache doctor that's accessible to you? Because I would say just about all the headache doctors are going to be okay going over this with you. And then, we have great neurologists, great family doctors, great doctors from other specialties who also do awesome headache medicine. But for a lot of people, they never got the teaching on this. So it's not that they don't want to, it's that they were just never taught it to then teach you. So that's where some of the difficulty lies, is if you're not finding it's a good match, it's okay to see if you can find someone different who's a better match for you. That's okay. Great.
So what role do you think resilience plays in migraine wellness?
So resilience is a really big thing. My co-author for this paper, Dr. Starling, she likes to say that migraine patients are some of the strongest people she knows. So she likes to talk about migraine warriors. So I think that's a really great launching pad for talking about resilience in migraine, because it's true. Migraine is the second most disabling condition worldwide, second after chronic back pain. Both are extremely disabling. The cost to society in terms of how much people, are affected in terms of they can't look after their kids or they're missing work. It's affecting their schooling, or when they're there, they're less functional. They're needing to go to the emergency room because they haven't been given, rescue medications that work, or they're not on a preventive medication. All of those things just so impact society, and yet it's a stigmatized disease. It's looked at often as just a headache. And yet these patients are dealing with so much more. I have patients who just are absolutely disabled when they come to me, and we can do really good things. I do find that there is an association with how well patients look at their pain. So pain is a very subjective experience, but pain is what you feel it is. So I always believe a patient when they tell me what their pain level is. You know, if someone tells me their pain is 10 plus, for them, their pain is 10 plus, and that's their experience of it. But there is something that we call catastrophization in medicine. And when pain becomes something that it evokes like your fear response, in addition to feeling how physical the pain is, you start to get this emotional pain or an emotional stress response. And you can imagine all the different things that happen when your body's in a chronic stress response. And so some of the things that we do, adding that routine in to help sort of set the brain to this more sort of constant level where then there's not these ups and downs of the stress response. Invoking some of the things like cognitive behavioral therapy and mindfulness, those breathing techniques, all help to dampen down some of that, you know, the fear response. Because you can imagine your cortisol is high, so like your body's internal steroids. And so when we can start to get around that, it's helpful. But when there's really significant catastrophization, to get a patient to feeling like they have that resilience, some of the first things you have to do is break down and really educate so they understand. I find a lot of my patients are asking for a very concrete diagnosis. And I explain to them, well, migraine is the diagnosis. That is the cause. And so that's often the first barrier when someone has a lot of focus on this being something fearful or dangerous is migraine's it's a genetic brain disease. That doesn't belittle it, but that means it actually is a dysfunction within the brain, within those pain pathways. You have a hyper-responsive brain and you've had sort of this genetic programming, so your DNA has predisposed you to it. And sometimes that makes it a little bit more palatable. It doesn't do it for everyone, but when we can get to that step, I find then people can start to focus on not the fear of migraine, but then how do we work to make this better? Like what are the treatments and how do we look at the whole person, everything else that's impacting it? Yeah, so it can be difficult because for some people it's terrifying to go through this. You feel like, you know, do I have a brain tumor? You know, this aura I had, is this a stroke? They keep happening. Am I going to become disabled? My grandma had a stroke. Am I going to turn into that? So it's a really scary thing to go through for some people in addition to the disability it's causing.
For sure. And I've talked with a wide range of people who experience migraine, many of them where they started at age 5 or age 8. And so it's just been a lifelong kind of companion. And, you know, that's just really unfortunate.
Oh
But one of the things that I have found personally is that there's this balance between acceptance and like resignation.
I agree.
And so it's like finding that balance of, yes, I have this chronic condition, and yes, I also intend and plan to live as well as possible.
Yeah. No, for sure. And some of it's a balance. You know, I have some people that they come, and when I first ask them, you know, how often are your headaches? They'll be like, oh, twice a week. I'll be like, okay, so are you headache free the other 5 days a week? They're like, well, essentially, I just have my normal headaches. I'm like, well, what do you mean by your normal headaches? They're like, well, I mean, I always have a headache, but that's just the normal one that's always there. It's not a big deal. And I mean, it is a big deal. It's not normal to have a headache every day or even have headache. That's not what we're supposed to feel. And sometimes I'm torn because they're okay with it. You know, they're coping and getting through it, but at the same time, it's not normal. And I want to treat and see if we can get them better. And when they're better, they often look back and realize like, oh my goodness, what a difference to my function and what a difference to my quality of life. But at the same time, if I'm not able to make good headway, I've now made them realize how often they have this headache. So it's this hard balance of, I want to help and make sure we can get them better. And if we can get them not having a headache every day, great. But if they're coping and they feel like that's normal and they're able to work through it and that's the way it's going to be, then I also don't want to ruin that coping, that resilience they have. So it's a hard balance. And I'm not sure that I always strike it right. I try to, but I don't know that I do. I think that's a hard balance. Because as a doctor, you want to fix and get people better.
Sure. And it is such a slippery illness, right? Yeah. It's just not something that like everybody's different. And that's why the migraine diet lists are all different. And, you know, it was very difficult to figure out, should I even write this book? But it seemed like there was a lot of information that wasn't kind of all together in one place and helpful. And because I have this food and nutrition and public health background, you know, it felt like a place that I could be of support to people. Yeah. So tell me, what are some self-care resilience strategies that you personally find most
Sure.
helpful since you're a busy doctor and you suffer from migraines?
So, I mean, first off, I try to stay well hydrated, especially in the age of telemedicine. I have some constant drink beside me. This is just a ginger tea. I do have caffeine, but I try to have my 1 cup a day, and I try not to let myself have more. And if I want more, I have it as decaffeinated. Um, I have a pretty regular bedtime and wake up time. I mean, sometimes I'll sleep in a bit on the weekend, but that goes a bit against what I advocate. And I've generally tried to exercise well, though I have to say, again, I'm human, and during COVID, I've not done as well as I'd like to. But I mean, I was going to the gym 4 times a week prior to COVID. And then when it comes to a lot of the stress, I mean, being a doctor can be stressful. Being during COVID can be stressful. I've previously gone through and I've learned cognitive behavioral therapy. I've learned mindfulness. So I have those techniques that I turn to when things are particularly difficult. And I think that they're really great skills that have set things up well for me. Then in terms of the diet, I've actually tried to even improve my diet further recently. So I have a very sort of plant-based diet. I'm definitely not vegetarian. I love my good steak. But I've tried to really increase my fiber and just like the amount of vegetables that I'm having on my plate and make that my focus of my diet, which I've noticed I feel better since doing that just in general. So that's how I've tried to follow some of the things that I have. Again, I'm human. I know I don't do it perfect, but I do my best to follow what I recommend.
That's great. Do you have any final thoughts on resilience for us before we let you go?
So I mean, in terms of resilience, I think start where you are and recognize that it's okay to know that you're hurting, and it's okay to be frustrated and feel hopeless, but that there's a whole community of us that want to help you get better. And it's okay to take baby steps, and it's okay not to jump to the finish line and just get there step by step. So I find a lot of the patients I see are very type A, and they'll be like, okay, have a good day. I'm going to go for like a 20-minute walk. And then the next day they crash and they have a horrible migraine attack, and they're really been struggling and exhausted. And I'd rather they do that, 5-minute walk a few times a week and not have it set things back. And then over time, can they build it to maybe actually do that 20-minute and not have it cause them to crash? So baby steps are okay. You're moving forward. As long as you're kind of doing the 2 steps forward, maybe a step or no step back, then that's okay. That's improvement, and you're making the effort and the progress to better yourself, better your life, and recognize that migraine is absolutely not something that is wrong with you as a person, and it's not a weakness. And in fact, in the words of my good colleague, Dr. Starling, you're a migraine warrior. You're absolutely strong for being able to go through this. And so you can do it. And we have so many people in this community to help you through it.
That's great. Thank you so much, Dr. Robley. Appreciate
Pleasure.
you being here today and sharing your story and your thoughts. You can follow her on Twitter at Jennifer Robblee, Robblee, to learn more about her work, and check out other episodes of the Resilience series on Facebook Watch, IGTV, and YouTube. And you can follow me at SWeaverMPH to learn more about my upcoming book, The Migraine Relief Plan Cookbook, due out in spring 2022 from Surrey Books. Thanks to everyone for watching. Bye.
Take care.